Hello, everyone. I'm Kevin Morrison, Cook County Commissioner for the 15th District here in the Northwest Suburbs. Thank you all for joining us today for our town hall on vaccine inequities. This is an important discussion on Cook County's COVID-19 vaccination plan. And I'm honored to have two incredible guests with me today who will address how the county determined where to send vaccine doses, picked mass vaccination sites, and how to get the vaccine itself. We'll be referring to history, data, and examples of systemic oppression as a guide during our discussion. As we near the close of Black History Month, I want to make sure we remember the past. And we, right now, are in the midst of a public health crisis. And we are dependent on institutions that have historically created barriers and caused harm to communities of color. Overall, the goal is to shine a light on how the vaccine distribution plan was developed and how Cook County Health is working hard to get all eligible residents vaccinated as fast as possible. This week, 130,000 Illinois residents were vaccinated in a single day. That is an incredible feat as we continue to ramp up distribution of the vaccine to our communities. We know these vaccines are a great hope for us getting out of this pandemic. Today, we would like to shed light on the injustices in our history that have sowed doubt and distrust among Black communities in public health institutions. Resources will be shared in the comments below. Please submit your questions in the comments and we'll answer as many as possible. With that, I'd like to first welcome Cook County's Director of Equity and Inclusion, Denise Barreto, to talk about her role and share her thoughts on this topic. Denise, thank you so much for being here.
Good morning. Thank you for having me. Yes, my name is Denise Barreto. I am the inaugural Director of Equity and Inclusion for Cook County Offices under the President. So this is my second time in the 9.5 months that I've been at the county visiting directly with your district. So thank you, Commissioner, for having me. As you may or may not know, I have been at the county since last May, at the end of May. And actually, I started at a very significant time. I started the week after the day after George Floyd was murdered. And I think that's a pretty significant thing because of what it says about the county's commitment, right? We're in the middle of a pandemic and of course that day has been a day that really changed our country and changed the world, right? Is it new news? Absolutely not. But I do believe that Mr. Floyd's murder at the time really awakened the world to anti-Blackness and really helped trigger a catalytic movement where everyone in the world, because anti-Blackness is not a United States thing. We don't have the corner on that. That's a global issue. And so the fact that the county was making an investment in their racial equity values is really key. And just in case you're not aware, my job is to be responsible for the design, coordination, implementation, and monitoring of our proactive equity and inclusion initiatives that support the Cook County Policy Roadmap. You know, it's funny, this isn't staged, y'all. I literally keep this thing. This is our brief executive summary of this. I keep this with me all the time. And the other thing that I keep with me all the time that thanks to Commissioner Morrison and his team is the final report from that committee on addressing bias, equity, and cultural competency. I am so grateful for support of elected leaders like Commissioner Morrison, making sure that I had this, like his team physically brought this to me during the pandemic. And it has been a rich resource to start to feed the work that I'm doing. And I just want to tell you really briefly two things I'm so excited about that I'm working on right now. One of which I pushed send to the legal department just yesterday, and that is our racial equity policy. You know, it's really easy to talk about a DEI initiative, or we want to have these racial equity principles, but you know, how you codify things and make them go beyond like the moment that you're in is to put it in policy, because policy and your budgets those are your moral documents of what is important to you. So want you to know we are excited. I believe we're one of the first jurisdictions in the whole country to have a racial equity policy. So I'm very excited because it's in the final stages right now. And that's one thing. And that helps it to incorporate some of the things that came out of this, including mandatory training for our entire staff. And the other thing I'm working on right now, which Commissioner Morrison has been a part of as well, is our language access policy. We are also this close to rolling out a language access policy. And what does that mean, right? Because you hear me saying this and you're kind of like, well, what does that mean? A language access policy, again, codifies the need and sets a map for how we translate materials, right? Because language or ability should not be a barrier for someone to be communicated with by government. And we have an obligation to communicate with everybody in the way that they need to be communicated with. And I'm very, very excited because that policy will codify, again, how we communicate and make sure and ensure across the county offices under the president, our translation and interpretation commitment. And what I'm really excited about, and this is hot off the press for you, Commissioner, and your district, you guys are one of the first ones hearing about it. Part of how this policy works is it's going to be segmented by district. So if you're in a district and there's 5% or more of your constituents that speak a language, then that's going to become a requirement for us to translate in that. And so we're just getting all that data back because, you know, the census data was a little bit behind. And, you know, we're not going to make it an unfunded mandate. So we are rolling it out gradually as to what is required, what's recommended, and what's encouraged. And just know there's not many jurisdictions that even have language access policies. San Francisco and San Francisco County, and then King County, Washington are among the few that we used to help feed ours. So as you can see, and I'm only on like my second cup of coffee, I could keep going and going, but those are the things that we're working on. And I'm so glad to be here to talk about the vaccine, to talk about how our history impacts our today, and more importantly, talk about the things we're doing now to ensure that the way that we're responding to COVID, you know, we're not responding just for the crisis we're in, we're also responding in a way to add equity and equitable principles to move forward, so that when we're faced with a crisis again, our same communities that are always harmed will hopefully be more resilient and strengthened by our work. Thank you.
Denise, thank you so much. You're a breath of fresh air here at Cook County, and I'm glad to have someone like you taking up the mantle and fighting for these equity principles here at Cook County. We greatly appreciate it. Next up, I would like to introduce our next incredible guest. We've got Cook County Health's Chief Medical Officer, Dr. Claudia Fegan, to talk to us about her role with the COVID-19 vaccine distribution plan. Doctor, thank you so much for being here with us today.
Good morning. Thank you. I'm glad to be here. So we recognize that there are two challenges for us. One, we're happy that the vaccine has finally been released and that we have it available to our patients and distribution. So we're trying to distribute it as quickly as we receive it. We each week wait to find out how much vaccine we are going to have available and then open up appointments for patients to get scheduled. But one of the ways that we try to ensure that we are getting the vaccine to patients who need it is by setting aside some of the vaccine for patients of Cook County Health. We know that we serve a population that traditionally doesn't have access to all the things they need. And so we are trying to be proactive and make sure that any patient who has been cared for by Cook County Health at any time in the past can get a vaccine. And so we know that there's some hesitancy about getting vaccinated. And we know that when patients have a trusted relationship with a provider, whether it's a physician, a nurse, advanced practice nurse, or a physician assistant, that if they talk to that person and have their questions answered, then they're more willing to be vaccinated. So we're trying to be proactive and make sure that we can get vaccine into as many people as possible. We also have been aside from offering vaccine at all of our locations by appointment, whether they are in the community or whether they're at our hospitals at Stroger and at Providence, but also have been providing vaccine at vaccination sites that can handle large volumes of people at one time. The goal is to get as many people vaccinated as quickly as possible, and we want to be proactive in that effort.
Doctor, thank you so much. I really appreciate you being here. I'm excited for this conversation. First up, we did have a submitted question that I did want to go to, and just a reminder for all of you tuning in live, please place your questions in the comments and we'll be happy to address as many as we can. We got from one of our contacts a question. I'm 78, I have COPD and cancer, not good with a computer. Will I ever be contacted for an appointment for vaccines? I can only last maybe an hour on a computer, registered at Cook County, ZocDoc, Jewel, Walgreens, and all say they'll contact me, but have yet to be contacted. Who would like to go first at trying to help this listener with that question? Denise?
Absolutely. First of all, I am sorry. Like seeing all that list of all the places, even though I personally don't have anything to do with that, like it is just know that you are not alone in that nightmare of trying. But let me start with what I think might be helpful, and that is our vaccine hotline. And hopefully we can make sure that it's put on the screen somewhere and you can stream it. We have a vaccine hotline because you know what? We hear this all the time. When I'm in the president's office, we hear that people can't get through on the computer. That number is 1-833-308-1988. Again, it's 1-833-308-1988. They are open Monday through Friday from 7 a.m. to 7 p.m. There are folks that speak Spanish and English. That's been a mechanism for folks getting appointments. And let me say, that is one of our equity mitigations, because let's face it, not everyone has broadband. Even if you have it, when you're not, people that are good with the computers don't always have good access. So that's why the hotline is there, and we're ramping it up to take even more calls and expand our hours. But that's where we are right now, and that's what I would recommend for someone who doesn't have a good computer connection.
No, that's very helpful. Doctor, do you have anything to add to that question?
No, I think that's right. I think that, we recognize that the people we're currently doing 1A and 1B, and we're people over 65. And so those are folks who didn't grow up with a computer in their back pocket. The young people are there much more agile with that. And so that's why I actually insisted on creating that hotline, because I just knew that there were going to be people who just weren't going to be able to navigate it. And being fast enough, we'll release 5,000 appointments, and they'll be gone in 30 minutes. We get, thousands of calls a minute, and just being able to handle that volume, it's amazing how quickly those appointments go. So yes, I think that's, we want to try to get that person in the queue so that when an appointment opens up, that they can get called back.
Fantastic.
Is there also, we're also directing folks to their primary care doctors as well. If they, because I noticed that they said they're registered at the county, they're registered in all these places, and that is good. That is not a bad thing. But I know that part of how they're connecting with people to let them know that appointments are open is through email, which of course pushes you back onto the internet. So, so I really will say that, like you're saying, they say they'll contact you, but it's likely gonna be electronic. So that's why the hotline is a great idea. But if you have a primary care doctor that you currently get care from, we would also ask you to ask your doctor.
That's amazing. And I know that, some primary care doctors have been receiving the vaccine. I know folks within my network who asked to be notified by their doctors, and that's how they were able to go in and get their first doses. We're blessed that we have 2 vaccines right now with high efficacy. There's a third one awaiting approval. The biggest crux facing the county and facing the country is just the limited volume of the vaccine itself. And so I pray every day that they pass that rescue package, because we definitely need the funding to go into production and distribution of this vaccine at greater volumes. And I look forward to that day. The first question I have for both of you is, or maybe Denise, if you would like to take this one on, is what are some ways that historical distrust of the government and health systems can be addressed by health departments?
Actually, I would like the doctor to take that one, and then I can fill in.
Yeah, so I think I was alluding to that before. And, people talk about the Tuskegee effect, but it's not just a Tuskegee experiment where Black men were given syphilis and then watched for years to see what the long-term effects were. I think that experiment showed a lot more about the people involved and the racism than it did about syphilis. But there was also the HeLa cells, so that Helen Lax was a Black woman who had cervical cancer. And those cells were, and I remember this from when I was in medical school, those cells were used for many years to study cancer and how it responded to various treatments without ever her permission or the family's permission. And you could go into a medical catalog and order HeLa cells without recognizing the story or what was behind it. So what I find is that makes the most difference for patients is for patients to have a trusting relationship with a healthcare provider. And there's no question that people like to have a healthcare provider who looks like them and talks like them and can meet them where they are. And the way in which we are most successful in broaching that long chasm of distrust is by providing people with providers who will be patient and listen to them and answer their questions. And I tell patients all the time, if you go to visit a provider and you have more questions when you leave than when you came in, or you don't feel that your questions were heard or the physician was in too much of a hurry to respond to you, then you need another provider. And so, we have over 1,000 providers who work for Cook County Health, and they understand who they're taking care of and the need to talk to, but more importantly, to listen to the patients that they're taking care of. And the way in which we deal with the years and years of distrust is by listening to people, because as people feel they're heard, then that's how you develop trust, by walking in their shoes.
And one of the things that I would add to that are 2 things. One, as we were setting up the communications, we're thinking about the historical, context. And one of the things I really, really stressed at the beginning is it's about our trustworthiness as an institution. You won't hear us talking a lot about hesitancy, because guess what? It's a righteous reticence. Okay. And it's historical, but it's also to today. Does anybody know the name Dr. Susan Moore? And if you don't, I want you to Google it, because that ruined my Christmas. Watching her videos on Twitter where she was advocating for herself and she, basically wasn't heard. And now, I literally, every day I get up, I think about the Susan Moores of the world who, she has a special needs son and an elderly mom that now have no one to take care of them, because in today's world, not in the history, today, a Black woman didn't get heard. And you know what? I can share that as well. Like, I just had a situation. I'm almost 50, pushing menopause, and I had to basically wrangle my doctor into getting me a test that helped us figure out something. And so Dr. Fegan is right spot on that it's partially us having to make sure that our providers understand where the trust issues are coming from, and that we don't just keep repeating that. What we do is we have to listen, and we have to acknowledge that Cook County has made a lot of investments in our equity, not only at the hospital, but in general. And so I think our case for why you should trust us is there, and it's still building. But you know what else we need to do? We need to make access more, because, the narrative of people don't want the vaccine is completely hindered by people who do want it in the Black and brown communities who can't get it right now. And let's think about the people in the Black and brown communities that haven't been able to get access to testing, right? Again, you can't even jump to the vaccine when the disease, the virus is ravaging communities that can't get tested, communities that have multifamily living situations, who make up a lot of our low wage workers. So it's not just about the vaccine, actually. It's really about what are the systems we're putting into place to make us more trustworthy as a partner with you in your health.
No, thank you so very much for that. And I tell you, the county has definitely progressed in recent years to really try to be as welcoming as possible. Back in the day when I could visit Cook County locations, going to our clinics, you see pamphlets that address all the great diversity that is Cook County, and it really feels like a welcoming atmosphere, and just ensuring that folks know that, when you come to our providers, you're going to have a voice that is going to advocate for you and your needs is critical. The next question I have is, what learnings from our county's history of systemic oppression can we pull from to make sure that those who are eligible have access to the vaccine?
So, you talk about having access. And so it is being able to provide vaccine to people in the communities where they live during a time frame that makes sense for people who have to work for a living. And so it's learning about, as I said, meeting people where they live. So I'm happy that at each of our ambulatory locations, we offer vaccines. So while the mass vaccination sites are great, while it's great that we have it at Stroger, we know on the west side, we know that there's been gentrification, and that many of our populations have been pushed away from where this hospital is located. It's great that we have it at Providence, which is located in the Black community, but there has been gentrification in that area as well. So it's important that we also offer it in our Robbins location, that we offer it in Fort Heights, that we're offering it in Blue Island, that we offer it in Logan Square. And although that's an area that we're looking to move, further west, because the population has been pushed further west, that we offer it in Blue Island, that we look around and see where are the people who are coming to us living. Let's look at those heat maps, the zip codes where people are coming, and trying to make sure that we're able to offer vaccine close to the homes of people, so that they can get an appointment and they can go get vaccinated on the way to work or on the way from work. So I think that's a lesson learned, that it's not, you can't just throw up a sign and say, okay, we're going to have vaccine here. I know we're going to have the federal government is going to put a mass vaccination site at the United Center, and I know that there are going to be a lot of hubbub about that. But a lot of our patients are not going to go there. That's not a place that's familiar to them. That's not where they've gotten health care. It's a bit unwieldy to figure out, how do I, go on public transportation, or, can I get a ride? So that some of that is overwhelming. When we have a mass vaccination site, even though we're doing great work there and vaccinating a lot of folks, for traveling that far from home is often a challenge. And I think that's a lesson learned, that, healthcare is local. You have to provide it close to where people are. And I think that's a failure. Nice, big, shiny buildings are wonderful, but people don't like to leave the neighborhood. And if we can offer a vaccine in the neighborhood, it makes a huge difference to them.
Oh, you're muted, Denise.
And I'll only pile on to that. In addition to all those things that Dr. Fegan says, Another lesson learned too is we built community advisory councils, which I have just started to be part of. So there was a meeting just the other day in Arlington Heights, the Arlington Heights Health Center. In Robbins, there's one in Cottage Grove, Morton East, and all of those advisory councils are made up of community-based organizations, faith-based organizations, people that are in the community, and people that people trust and know. Because ultimately, I don't know that a lot of people, I've heard it, people don't trust government, but they do trust people that are in their communities. And so us partnering, we have a great partnership with Partners in Health. And part of one of the things that we're doing is really getting linked up with these community-based and faith-based organizations. And another thing that you were saying about what the question is, how are we pulling to make sure? The other thing is we are distributing vaccine in Jewel Osco's, Walgreens, Mariano's, hospitals, and other places. So again, not necessarily counting, just like Dr. Fegan said, I heard about the United Center thing just within the last hour. And while that is a good option, and I heard that that's for the whole state, right? That's not just going to be Cook County. That's, Illinois residents in general can arrive there. But I agree with her. If that's not some place that you're familiar with, it's not some place that you know how to get to, you're not going to go. So that's why, the Walgreens, I love that your question, the person said they were already registered with Walgreens and Jewel, because all of those places are places that we're also trying to penetrate to make sure that people have information. And again, I'm just going to say it, we've got to start getting vaccine to people in these communities, because you know what, even more important than their church community or their pastor is their aunt who goes to that church, right? And I know for a fact in my family, people are like, did you get it? Are you getting it? And that, the people that influence people the most are the people in their life, right? And so the better that we can start to penetrate and even just start to get these shots in the arms of people, because yes, we have hesitant folks in the Black and brown communities, but we have a lot of folks in those communities who want it but can't get access. And guess what? When you can't get access, that feeds the narrative of not being able to trust. And so any way that we can, and we're setting up a bunch of pilots right now where we're going to go into a site. I think I see that has to do with a question. It actually dovetails into the question that we received on when a mobile site will be ready. I don't know exactly when a mobile site will be ready, but I do know that they are being worked on right now. And part of how they're being picked is based on another thing I was going to say, which is our social vulnerability index. Not sure many of you have heard about that, but that's basically a bunch of data that we look at that looks at education, looks at languages spoken home, look at your access to transportation, looking at things that affect your health outcomes, because we know there's like 3 or 4 or 5 questions you can ask, and that's going to tell you how vulnerable somebody would be to this vaccine, and how vulnerable they would be to sickness in general, and vulnerable to negative health outcomes. So when you look right now, I can tell you, as we're standing up even the mass sites, we're having a checkoff list of these are the equity things that have to happen. We got to have access to transport. We got to see how many social vulnerability communities and the concentrations, because may not be the whole municipality, but there's a part of the municipality. So we're refining and learning and optimizing daily.
No, I think that's critical. Oh, Doctor, did you have something to add to that?
Well, I was going to say, so one of the challenges we had initially is the first vaccine we had was the Pfizer vaccine, which required these special freezers. And we were trying to have locations that were going to be close to the freezers, because we didn't want to thaw out too much, and because then you have to use it within so many hours, and we didn't want to waste a single drop of vaccine. The Moderna helps us because we can have it thawed out and we can have it available in a refrigerator for 30 days. But the Johnson & Johnson will be a game changer, because that just requires regular refrigeration, and it also only requires 1 shot. So that's going to be that's a more, that's something easier to put on a van that will drive around, because then you don't have to worry about having the refrigeration at exact temperatures, and it offers more opportunities. And people, I want to say this right away, because people have been hearing, well, it's only 60% effective, or 66% or 70%. Actually, I think in the United States it was 74% and 66%. But what people have to understand, it seems to be almost 100% effective against preventing hospitalization, and it's effective against serious infection. So people could become affected, but not as severely effective. And I also want to say that we have been spoiled, because the Moderna and Pfizer are new technology. It's very different from anything we've ever seen before. We never had a vaccine that was 95% effective before. I want you to know that the vaccines that we generally use for common diseases are usually only in the 70%. So the idea that you have a vaccine that'll be 100% effective against preventing hospitalizations, that may drop after we do a few million people. We see that, but it still is going to be quite an impressive. So all of these vaccines, from the studies we have, are extremely effective, and far more effective than anything we've ever had before. So the idea, and people say, well, they developed it too quickly. And I want people to understand, this is technology that we've been working on for years, that that COVID is the same family of viruses that caused SARS, that we actually, and in the same family, we've actually been working on this since Ebola in terms of technology, because we saw this class of virus that was different from anything we had been trying to deal with before. So it's been a long time coming in terms of technology, and the fact that we were able to get it specific to the COVID-19 is very encouraging. Not only that, the fact that when we see these tweaks, when we see these changes and these variants, all viruses mutate. That's a very common thing of viruses. But even if we were to see a mutation, and we haven't yet see a mutation that doesn't seem to be responsive to the current vaccines that we have out, now that the method used to develop it allows us to change or tweak it incredibly quickly. So I think that people really need to know, I've been vaccinated. I'm happy to have been vaccinated. I think it's a game changer. And I think that everyone needs to feel safe, encourage themselves. You get vaccinated just not to protect you, but to protect the members of your family. Because even though you may be healthy and do well, that you could potentially, without even realizing, transmit the virus to someone who won't do well. And it's not predictable. People who look healthy, seem healthy, get this virus and have poor outcomes. So I'm very excited about the opportunities to have what looks like will be 3 different vaccines available that will meet our needs. And, none of us is safe until all of us are safe. So it's really important that we understand how important it is how we get vaccinated, and that we encourage everyone we know to be vaccinated.
So many incredible points. Just real quick, Denise, before I pass it over to you, have just been addressed, and I just want to unpack a few of them. I'm an avid reader. I've been paying attention to COVID since its earliest days upon the initial warnings coming out of China. And one thing that is so critical to know is the last time we had such a massive pandemic like this was in 1920, 100 years ago, before the advent of modern science. Most of the modern developments in healthcare and science did not develop until the beginnings of the 1940s. And so a lot has changed since then. When we talk about the common cold or the flu, those had their advents back before modern healthcare. One thing that is so interesting concerning COVID-19 is it caused health departments, public health, all across the world to immediately start focusing their eyes on how to address this virus. And that had never occurred concerning any other virus before. There have been more scientific studies in looking at COVID-19 than have ever been done on the flu or the common cold. Right. And that is so critical to know as well. And when it comes to the Johnson & Johnson vaccine, I believe there were no deaths from individuals who went through that study, which is so critical to get out there as well. Now, the next thing we talked about issues with transportation and the like, trying to grow sites throughout the county, make sure that we have access for all communities. I learned that we've got about 32 partner sites in the north and northwest suburbs with Jewel's, Walgreens, Mariano's, and CVS. Now, there are locations out here, and as we get more doses of vaccine, there will be more partner locations, more county location in the days to come. And you address potential mobile sites when we have a vaccine like Johnson & Johnson that only requires regular refrigeration will be a game changer. And so my office is working throughout this pandemic to try to get information about services out there, but also right now is looking for locations for potential mobile sites when we're able to start moving in that direction. And so lots to come, and we will always be keeping this updated. But we as people always have such a critical moment because we are in those communities. So us sharing information about, say, a future pop-up site is going to be critical, and we got to help make sure that all of our neighbors learn of that information. Denise, I know you had a point you wanted to throw in.
Yeah, first of all, I love doing these because I love to learn too, right? And so you know, when you're sitting on a panel and you're getting fed as well, thank you, Dr. Fegan, because I've been reading and trying to follow as much as possible. And can I just take a moment to say thanks to both of you, because I don't know that people realize this. We're in the pandemic with you. I'm going to say that again. In addition to being charged with responding to the pandemic, we are in the pandemic with you. I have a 15-year-old who's been trying to get my attention for the last 30 minutes after I told him I was on already. So I want to take a moment to say that, because I think the other thing I hear all the time, you know, people have such, disdain for the government, or they're so upset, and why can't they get it together? Because guess what? We are people too, and we are also experiencing this trauma. We're all experiencing it together, but not everyone's experiencing it the same. And that's the last point I wanted to make based on something that Dr. Fegan said, which is that she said something about not everybody's not safe until we're all safe. Well, guess what? That dovetails into inequities, right? Until we fix these systems for everybody, we're all vulnerable. And that's something I think people just don't seem to get. And no matter how privileged you are or where you live, this virus does not discriminate. And guess what? It's taking rich people out as much as it's taking other people out. And comorbidities originally we were talking about were the big thing, but I've seen healthy marathon running, middle-aged white guys drop dead from this. So I just want to make sure that people understand that, because I've heard a lot from the Northwest about people being a little bit upset about our focus. And guess what? That is for your benefit. Who do you think are delivering your Amazon packages? Who do you think have been keeping our economy going, being the retail workers that you're sending your kids to college to not be? So the bottom line is until we look at the United States as the United States, and we're only as good and as safe as the most vulnerable person in our community. And so it is in our best interest to make sure that we're all supportive of any ways that we can mitigate the spread of the virus, that we can mitigate the effects of the virus and get as many people vaccinated as possible. Because the last thing I will say is the risk of getting the virus is so much greater for people that look like me, regardless of what my health state is right now. And so I can't wait to get the virus, and I have a ways to go. I have no idea at 49 when it's going to be my turn.
But get the vaccine, not the virus, right?
Exactly. Oh, what did I say?
Get the virus. I want to reach out to that question about why we have not included people with disabilities and behavioral and developmental disorders in phase 1B. And so, you know, the governor has advocated for this expansion, and there are conversations going on about that. But the limiting factor for us is having enough vaccine to give people. So why, you know, we were concerned about frustrating people by, if you expand the number of people eligible by another 3 million people, and you still don't have enough vaccine for the 3 million people you're trying to vaccinate in 1B. The elderly gentleman, the 78-year-old gentleman talked about, he has put his name on all these different lists and hasn't heard back. It's because there are not enough appointments for the people who are willing to get vaccines. So there are two tensions here. First, we're trying to encourage people who are hesitant to get vaccinated. And then there are a lot of people, about 50% of the population, who said, I want it yesterday. And we don't have enough vaccine for those folks who say they want it yesterday. And yet we understand that if we only vaccinate them and don't vaccinate, even those folks who are hesitant, we won't be safe. We won't get the benefit of having the vaccine. So any delay in expanding the number of people is only because our concern, and we really literally only find out from week to week how many doses of vaccine we're going to receive. It's just that tight at this point. And the snowstorm put us behind, because we had one of our workers who, even though his supervisor didn't want him to, drove all the way through the snowstorm down to Peoria to pick up doses of vaccine so we could have more vaccine to distribute at our site, and because the trucks couldn't get through. So it is a daily battle. We have a call every day, multiple calls every day, talking about how we can distribute the vaccine and get it out to people who want it. So I understand people say, why are they not, I know lots of folks, Denise says she wants to get vaccinated. My kids are in their 30s and they want to get vaccinated too, because they, they want to be able to move about. But it's trying to make sure that we get it to as many people as possible, but not let the frail and the elderly be left behind because they can't run to the front of the line like others with other resources.
And there's another, the two dose thing is also a complication that I don't think people are accounting for. So let me tell you something I heard on a call this morning. As we're trying to figure out, like, each week what we can do and what we can't do, we have the timeliness of what the second dose is. So that's the other reason why the Johnson & Johnson's going to be a game changer, because right now, like Dr. Fegan said, we only get so many doses per week. Well, guess what? We have to hold back some of those to second dose somebody. We can't just take those. So when we say we're releasing 5,000 appointments, some of those appointments are part 2, right? So they're not even touching new people. And so when you have a week like Dr. Fegan referenced with the snowstorm and you only have so many, the clock is ticking, because there's folks with the first shot in their arm that we absolutely have to get the second shot to before, and we have an obligation to do that before we do a first dose on somebody. So do you see, like, right now there's so that's the other reason why the Johnson & Johnson, in addition to the technology side of it, it's also going to help us on the complication side, because it is not easy. And as you can imagine, having to keep track of every person that has it and make sure that they get an appointment in the week that they need, that is the follow-up week. So just wanted to highlight that, because that's just another added layer of complexity to this very, very complex problem.
100%. I know we all dream for the day when we have so much vaccine that we're struggling to find people who haven't had it yet. So I definitely look forward to my place in line as well. I do not fall into 1B. With all of this in mind, what does an equitable distribution of COVID-19 vaccine look like? How are some of these mass distribution sites chosen? What does some of those conversations look like in terms of making sure that the hardest hit communities have access to vaccine, and that we're able to make sure that those communities were considered in some of these plannings?
I'll start. So, Kevin, Commissioner, that's a very tough question, because of course, we're all looking at the heat maps. We're all looking at the data of where people are most affected. And that is what keeps us up at night, right? There's no question about that. But we're balancing an imperative of volume, okay? And I am here to tell you, in my experience on this earth, efficiency and equity are not friends. They're just not. And so this idea that, oh my gosh, we got to get thousands of people. And when you do things that are for thousands of people, you're not taking into account, where thousands of people might be in society and what their barriers might be. And so I'm saying that with all the sincerity of, I could say this on behalf of the president. I talk to her every week. Of course, her view would be that, the most vulnerable people will go first. No matter where they are, no matter what their vulnerabilities are, it wouldn't even be a thing. So that's first. The other thing that I also want to make sure that people understand is what we're experiencing also has to do with our lack of a federal coordinated response. And I don't think, you can't dwell on that, but we do have to remind people of that. There are countries that are already on the other side of this because they had one plan and then that plan was pushed out through the jurisdictions. And guess what? Because all the jurisdictions have different we have different strengths and weaknesses, right? Whether you're a city, a county, a state, and the way that we did this was you're all on your own, right? And so we all had to come up with plans, and that's not normally how stuff like this is addressed. And I'm going to say it, and if I get in trouble, that's fine. There's only 2 times we need the federal government, and this is one of them, okay, in life. And so we weren't able to count on them. They have stepped up, and we see what's happened in the last 30 days. We see what's happened in the last, even 45 days. But our vision is to get as many people vaccinated as possible and do that in the most equitable way. So that tension that we live in means you're gonna see us standing up sites, but sites that have access to public transportation, that have ADA. One of the things I'm yelling about now is universal design inside, right? Since we're building out places, I want to make sure people with disabilities can maneuver through those places. And then we're talking about public transportation, the SBI. So those are all every single time we do that, we're doing that in mind of volume, and then how do we hit our equity targets at the same time?
100%. No, I think that's so important. And one thing, I know that folks are curious about this, but what is the best way for people to share constructive feedback so we can improve the distribution plan as things progress?
Well, I think you all know how to find us. Let me tell you, I've never had a problem with people finding the president's office and sending emails, and it's actually your representatives too. I think part of, at least one of the things I do, if I'm going to be doing something that's outreach or in an area where a commissioner is, I always check with their office to find out what they're hearing. What are they hearing on the ground? Any of our websites have mechanisms for you to let us know what's going on. And believe me, we're getting the pictures. You want to know one of my favorite instances of getting feedback was recently? I was at the Robbins Advisory Council, and literally someone said anecdotally, wow, we have never seen more white people in here than we have in the last few days, right? So that was one of the first indicators, not the first, but that was one of the first indicators that the things we were doing to push appointments in different zip codes weren't happening, because people who have multiple devices and can sit and get in line in many different places, people will figure it out. Like the vaccine is seriously, there's subversive things going on right now to try to get in line with that. So
yeah, so that was one of the things, and it's actually it was at Inglewood Clinic that was seeing so many folks who had never been to that neighborhood before, who came to get vaccinated, and we had been advocating the need for our patients, and our staff wanted to be able to vaccinate our patients. And so it was after that event that we were able to convince folks that we were going to have to set some vaccine aside for our patients, and so that a doctor could say, Mr. and Mrs. So-and-so need to be vaccinated. And they say, let's get them in, let's get them an appointment. So I think that and I don't want to keep vaccine from anyone, but I just want to make sure that everyone has a fair chance. And, when I, talk to a patient and she doesn't own a smartphone or even, what are you talking about? She needs to have a chance to be able to, how do you get vaccinated, and I can say as her doc, I want her vaccinated and I can get her an appointment. So I think when we're talking about how do we deal with that, Denise is right. Each site we look at, we want to make sure that it's ADA accessible. We want to also make sure it's close to public transportation. So it's not just people with cars, and that people can, take the bus or take the train and get there for that appointment, not require a ride from someone or require a Medicar to get there. But, it's also that, if they need, they need to come to the clinic, that we can provide it for them there. So, and I want to say, we could keep talking about Cottage Grove. I want people to realize that's located in the Ford Heights community. So that, and then we do have the Arlington Heights location, and we do have a New North Riverside location. That each of the locations, we're trying to make sure that people understand they can get an appointment and they can get a vaccine there.
No, amazing. There's one recent change by the CDC that I thought maybe you could address, Dr. Fegan. I listen to this news show every morning, and Amy Goodman always says, wearing a mask is an act of love. Wearing two is even better. Now, when I'm out in public, I wear an N95. Luckily, I was able to buy a package of 10. Maybe you could give more detail of when wearing two is appropriate and why that change was made.
Right. So how can I put, the problem is people wearing a mask that fits them properly, so when I see someone walking around with a mask below their nose, I'm like, why did you bother? Or we started to refer people wearing a mask down here as a chin diaper. What good is that? So, I wish that people would focus on, the CDC made the recommendation because we're having such a struggle in terms of getting people to wear masks appropriately. And there's no question that, two is better than one. Although I'll say this, that, three is not better than two. That, you can have too much on there because you're going to have a lot of problems with perspiration. You're going to have problems with people talking about the skin changes they see with wearing the mask. But if you have a well-fitting mask, and that means sometimes it means to take the mask and so it doesn't have gaps. So sometimes we find that if you have a small face, if you turn a loop, that you can make it fit properly, as opposed to a lot of the cloth masks are good. And Denise is showing the ones that have adjustments so that you can change the size of the loop so it doesn't drag down. But it's really more to make sure that it doesn't gap and that it fits against your face. And we find that the chances of that are better with two masks as opposed to one. The one thing that we in the medical community worry about is that it will increase the demand for masks and that we'll have shortages again. So what we really prefer is, like if you wear a procedure mask like this and you cover it with a cloth mask, then you have multiple layers and you have protected yourself and you're protecting everyone around you. So the idea is to have a mask on the person who might have the COVID virus. And so we're asking, everyone, even if you've been vaccinated, to continue to wear your mask. And two masks is most helpful when you're going to be in a closed setting. If you're outside in open air and you can have distances, then one mask is quite fine and sufficient. But when you're in a closed setting and you're not able to be distant from other folks, then two masks is helpful.
100%. And I know right now getting community transmission numbers down is critical. It's something we all got to continue working towards. I've heard recently, one of the fears, and, they say that folks who have already had COVID, have about a window of 6 to 8 months of potential immunity from recontracting. We don't know much more beyond that.
We don't know that for sure.
We don't even know that for sure.
Right. And I have
that I think is important.
Yeah, the New England Journal, I have the most recent New England Journal, is raising the question about people who had mild disease or asymptomatic disease. Do they actually have enough immune response? And will they be protected? So people make an assumption because they've tested positive that they're protected, and it's not given. And we're actually recommending to go ahead and vaccinate those folks.
Well, and viruses are are all about their own personal gain. They want to make sure that they're the dominant variant that is able to spread as far and wide as possible. They're very, very selfish. And so one of the fears is even someone with some immunity, there might be a variant that wins out, and they win the big lottery. Now no one has any immunity toward that variant. So that's why it's important for even people who have recovered from COVID to continue wearing a mask and washing their hands and continue making sure that we're not seeing this community spread, allowing for these new potential dominant variants to come up in our populations.
You've really been reading. You really have.
I'm impressed.
Virology. A lot of very basic virology that I learned some years ago.
I love science. I in my office, I even have a periodic table.
I saw that.
No, it interests me. I love science. I want to know as much as I can, and it's going to be important, especially for us public servants, us folks who are able to have these conversations with the public, to make sure that we're trying to share accurate information of what we know now, and making sure that as things progress and we know things that have changed and progressed, that we get that information out there too, and we make those corrections as time goes on. But I know we're reaching the end of the hour. This has been an awesome conversation. I'll start first with Denise. If you want to have any final thoughts that you would like to share.
The two final thoughts is that this situation is the most fluid situation I have ever worked in my entire life. And so the two things I want to leave us with is I want everyone to have some patience. And I want everyone to have some grace. Again, I'm not saying this for myself or for us because we're your public servants. I'm saying this to you. I think even people that are stressing themselves out trying to do this, remember, we're still in the trauma of a global pandemic. And so I ask you to be patient with yourself, be patient with us, and be gracious. And trust me, if you are gracious with yourself, you have a shot at being gracious for other people.
I love that. No, thank you so much, Denise. It's been great having you here today. Dr. Fegan, any last thoughts for our guests?
Yeah, they seem like small things, but they make a big difference. So yeah, wear your mask and wash your hands and keep your distance. I mean, it all makes a huge difference. And it's the way a lot of countries have gotten, down to zero without having any vaccine. Vaccine will change our lives, but in the meantime, these things, you can't forget about them, and we have to continue to wash your hands. If you touch the front of your mask, you have to wash your hands. That front of the mask is the filter. And if there's virus out there, it's going to be on the front of the mask. So I watch people who are doing this and doing this to shift it up, then you need to wash your hands. So these are things, small things that we can do that make a big difference. And we'll get to the other side. I know we will.
I appreciate that. And before we come to a close, I'll share a personal story with the public. I've always been a bit of a germaphobe. And, I always wonder, like, whenever you're in a public restroom and someone just washes their hands after going to the restroom, but then touches the faucet to turn off the sink and then goes and puts their hand on the door to walk out, why did you wash your hands? Those are contaminated areas, and we have to be mindful of that. When we go to the grocery store and you touch the door to open it, you don't want to be touching your face, your eyes, your nose, your mouth. Those are potential ways that you're allowing viruses and other things, bacteria and the like, to get into your most critical access points. So being mindful of all of that is critical. When you use a public restroom, try to use a paper towel, use your shirt, an area of your shirt you're not going to touch often. There are ways that we can definitely not only safeguard ourselves, but the loved ones around us. So again, thank you all. Please continue to send questions my way. We're always going to try to get you those answers. And thank you all for joining us today. It's been an honor to have you, Doctor and Denise. Thank you so much.
Thank you for having me. Glad to serve.
Thank you.
All right.